Symptoms can be quite widespread because our brain controls nearly every aspect of our behavior, our functioning. So, symptoms are going to be categorized for the sake of this presentation into four categories. But as I'll discuss, these categories are not isolated from one another and they can often affect each other. So we'll talk about symptoms within our cognitive or thinking areas of our life and our brain, sensory issues, physical challenges, and emotional and behavioral symptoms. So, brain injuries can cause a wide variety of physical symptoms, but not everyone will have all of them or any of them. But some of the most common ones include loss of motor function, so trouble moving certain parts of the body, difficulty with communication, as Jess mentioned, and this difficulty can stem from challenges within our brain in, for example, producing speech, but it can also be a physical symptom if motor function is lost within the jaw or the face to be able to produce speech. This can manifest as aphasia, as problems with speaking, understanding, reading, or writing language. Seizures are also another common physical symptom, headaches or chronic pain, fatigue, sleep problems, and balance issues and dizziness. So these effects can vary widely depending on the area and severity of the brain injury. And in addition, we can also consider if there were physical injuries occurred during the injury, like, for example, with a car accident or a fall, that can also contribute to some of these physical symptoms. Next, we'll discuss sensory symptoms. And brain injuries can affect many of the senses, even if the eyes or the ears or other sensory organs themselves are physically healthy. And this happens because areas of the brain that just mentioned that are responsible for processing sensory information may be affected by the brain injury, while something like the eyes are not physically affected. For example, even if someone has 20/20 vision on a vision test, their brain might not interpret what the eyes are seeing correctly, or the pathway that decides how to react to that visual information may be affected. This can lead to trouble judging distances or tracking moving objects, which, as you might imagine, are important for things like driving and other activities that we participate each day. This is why it's important to identify which areas of the brain are affected and to work with specialists who can help determine the root causes of these symptoms before we dive into treating some of the sensory symptoms that are on the screen here. So, moving forward to cognitive symptoms, these are basic thinking skills that we use every day. For example, how we pay attention, think, remember, and process the information that we take in. And when we say process information, we're really just talking about how our brain determines what that information is and the proper response to that information that's coming in through our sensory system. Some common changes that may occur after a brain injury in cognitive skills include trouble concentrating or staying focused on tasks, difficulty paying attention to tasks or activities that may have been easy to attend to prior to the injury, feeling confused or having brain fog, slower thinking or processing of information, whether you're receiving that information visually or through your ears and hearing that information. Memory problems like forgetting recent events or instructions or remembering information to complete a task, and difficulty with learning new information. These changes can make our everyday tasks like work or school or even social situations much more challenging. So changes in cognitive skills contributes to the invisibility of brain injury because these challenges can be present or even severe despite someone looking quote unquote fine on the outside. These cognitive symptoms are often very difficult to spot for individuals who even know the individual with the brain injury quite well. Often, when we discuss cognitive impacts of brain injuries, we hear the term executive functioning or executive skills. You can think of executive skills like the brain's manager or CEO, like Jess was discussing earlier. They help us to plan our days, organize things, make decisions, and follow through on the tasks that we need to complete. Some common executive skills challenges caused by brain injury include difficulty planning or managing time effectively, difficulty organizing or prioritizing tasks, thoughts, or areas of our environment, problems starting tasks or knowing where to begin, trouble staying focused on a task, difficulty finishing tasks once they are started, and challenges with problem solving or making decisions. And lastly, reduced insight or self monitoring. So, this can mean that it can be hard to notice that you're making mistakes or figure out how to adjust or change your behavior based on challenges that come up when we participate in everyday tasks. These changes can show up in everyday life in ways like missing appointments, leaving tasks unfinished, forgetting steps when cooking, or struggling to decide what to do first when you're trying to accomplish a task. Cognitive rehabilitation and adaptive strategies aim to help individuals to work around these challenges, like things like using checklists, alarms, planners, step by step instructions, or developing structured routines to help manage and support daily tasks and regain a sense of control and independence despite some of the deficits that we discussed that may be a result of the injury. So we know that cognitive challenges and executive functioning challenges, as well as physical and sensory system challenges, can all affect our emotions. So, how we tolerate the frustration of those challenges, leading to anxiety or low confidence because a person knows what they want to do, but has trouble organizing or completing it for a variety of different ways. So, brain injury can absolutely affect mood and behavior in the following ways. Some examples include irritability or feeling easily annoyed or upset, frustration when struggling with tasks or challenges, aggression or agitation, depression, anxiety, or even apathy. So, just completely losing interest or motivation for activities that you used to really enjoy. So it's important to know that many of these changes can be heavily exacerbated or caused by the brain injury. And as such, they're not personal or intentional, which can be quite difficult for individuals who support someone who's living with a brain injury to manage and to understand. Support, including therapy, which may review and teach coping strategies, can help to manage some of these challenges. And additional rehab, like I mentioned, cognitive rehab, can help to mitigate or remediate the cognitive symptoms that can also be contributing factors to emotional regulation challenges as well. And lastly, on our categories of symptoms, we'll talk about behavioral symptoms. So these are commonly related to emotional symptoms. And it's common to see these challenges in how someone controls their behavior, emotions, and social interactions. Examples can include disinhibition, which is saying or doing things without thinking, or speaking before we think, impulsivity or acting quickly without considering consequences, personality changes, which can span widely, impaired self awareness. So, back to that cognitive skill of not recognizing challenges or mistakes, poor social skills, trouble regulating emotions or feeling overwhelmed, angry, or sad more easily, and then lacking the ability to implement coping strategies to manage some of those challenges. And really just feeling emotions much more intensely than prior to the injury, stronger reactions to situations than one is used to. So these changes can be frustrating for both the person and their loved ones, friends, and family, but they are a common part of recovery and they can improve with support and coping strategies, as we talked about a little bit before. So, to round out our talk about symptoms, as you'll remember in an earlier slide, we referred to brain injury as an invisible injury, meaning that for many individuals, their internal struggles can remain hidden from view to the outside observer. So we can think of this like an iceberg. Outsiders may only see the surface, such as maybe a small behavioral change, physical fatigue, or maybe a limp because of a weakness on one side of the body. However, the vast majority of the impact on the individual typically lies beneath the surface, involving complex cognitive, emotional, and neurological changes that others cannot easily see, but that have a wide-ranging impact on the individual's day-to-day functioning. So again, some of those impacts are listed on this slide, and they are not as easy to spot as one might see. So we often remind our clients of this invisible injury phenomenon that accompanies brain injury as a chronic condition.